When two effective organizations join forces to reach a common goal, good things can happen. The American Hospital Association, through its Institute for Diversity and Health Equity, is working closely with Unidos US, the nation's largest Hispanic advocacy organization. The goal to improve community health across the nation and increase diversity among healthcare leaders, shaping the future of care. Their joint project is the Healthy, Equitable and Resilient Communities Initiative. It encourages AHA member hospitals and Unidos US affiliates to work together to respond to challenges of disparities, violence, and trauma. This podcast series explores how research helps community and healthcare leaders meet the needs of those they serve and advance health for all. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hetterly, Senior Writer at AHA and your podcast host. In this podcast, How Clinical and Community Collaboratives Innovate, we'll take a look at St. Anthony Hospital's Collaborative for Community Wellness. This Chicago-based collaborative is made up of 22 community-based organizations. Over the next few minutes, we'll explore the value of community collaboratives and their impact on increasing access to health and healthcare. Dr. Arturo Carillo is the Mental Health and Family Support Manager of St. Anthony Hospital's Community Wellness Program. Dr. Carillo also helps lead the Collaborative for Community Wellness. Also joining us today is Patrick Brosnan, Executive Director of Brighton Park Neighborhood Council, who is an Unidos US affiliate and a member of the Collaborative. Thank you both for joining us. Dr. Carillo, as a healthcare leader and practitioner, how do you see your role in the transformation of our healthcare delivery system?
I feel like I wear two hats constantly. I wear a hat as a clinician. I'm a trained LCSW, and that's been, for me, such a passion to be able to allow spaces for people to heal from experiences of trauma in a way that, unfortunately, are very limited for people. On the other hand, I also have a hat as a researcher and program administrator. And part of that has been to think about what partnerships and collaboration could look like as a way of bringing access to services in the way that we have at St. Anthony Hospital by having financial investment to offer service delivery in a way that's accessible, embedded within the communities and alongside with the partnerships with community organizations that are so valuable to us. So having those two hats and constantly juggling that position has been very important, because I think that for me it's so critical that when we talk about trauma-informed care, we do really have to unpack what that means. And so part of what I've seen as a clinician is that, the type of therapy that we offer, free of charge, embedded within communities that have high needs because of the experiences of trauma that are built into people's experiences in low-income communities, compounded by the fact that those same low-income communities have the lowest percentage and ratio of clinicians, in some cases zero, to the population of residents. It really is meaningful for me. I had early on in my training, my clinical supervisor say that our mission was to offer the highest level of care, the type of care that people get on Chicago's Gold Coast when they could afford to pay out of pocket, those rates that clinicians charge upwards of $100 per session. We're doing that same type of care in the community free of charge. And so think about the preventative and emotional aspects of giving people that space to heal on a long-term basis, right? Because we also know that treatment for trauma is not done in 1 or 2 sessions. It's not done in a medical setting in a 15-minute warm handoff to a clinician. It really is done in a very safe space where people can really talk about, unfortunately, the prevalence of trauma that people have experienced by sexual, physical, emotional abuse. Those are things that leave scars. And so for me, thinking both as a provider and as a program administrator, we've been able to find funding, aside from the hospital's funding, to continue to partner with community organizations like Brighton Park Neighborhood Council, other organizations who've been part of the collaborative, to bring therapists into those settings to offer those services free of charge. So part of what, for me, is always a critical thing to understand is that when we talk about violence and the impacts of violence, we unfortunately know that violence leaves physical scars, but they also leave emotional scars. And so when we think about trauma-informed care, we often overlook the need for trained professionals to be offering those long-term safe spaces where people can really feel comfortable in unpacking their hurt. And so one of the things that I'm most proudest of in our mental health work as a clinician is that a third of our clients that come through our offices are men. And these are men who've experienced extreme hardships and violence throughout their lives. And so our research was actually very telling because we were able to assess what mental health needs were for men as well as women. Nearly a third of our respondents were men compared to 2/3 women. And so, having that breakdown of what the mental health needs are by gender were very telling. And essentially they are the same. People who are hurting are crying for help, and these type of partnerships in very innovative ways to find trained professionals, spaces in communities to offer these free services like we have with Brighton Park Neighborhood Council and other community organizations has been essential to thinking about what a different Chicago could look like, where resources are more equitably distributed throughout communities which have high needs.
Patrick, same question. What role do community leaders like you play in innovation and transforming the healthcare delivery system?
In one of the previous podcasts in the series, I spoke about the Brighton Park Neighborhood Network. What that is, to reiterate, it's a coalition that we formed in partnership with about 40 different service providers and institutional leaders and institutions in the Brighton Park community. And so not only are all of the healthcare providers participating in that network on a regular basis and are active participants, but also schools, churches, and other social service providers. And then also a lot of community leaders, people who are just active in the community and want to be more involved, people who are involved in the park district, people who are involved in the Little League. They're all participating regularly in this. So what we believe is one of the roles of the community partner and of the Brighton Park Neighborhood Council in this situation is to bring all of these providers together and to make sure that we're creating a space where they're communicating in a strategic way, that they're thinking about how their services cross each other, how each of the clients that they serve might be involved with the other institution as well, and to really understand kind of how the gaps in services that are being provided in these different institutions affect the way that those other partners can provide services to the community. So we're organizing very regular meetings between all of the different providers, all the different members of the Brighton Park Neighborhood Network. In the health committee, it's not only the health providers that are participating in it, there's also educational leaders. So this is a space that they have told us that this is it's a very unique opportunity for them, because not often are they able to talk to a school principal about, okay, this is the healthcare that we're providing to the students in your school. How is this improving their educational outcomes? What are some of the other needs that your students have, that your families have? They don't get the opportunity to do that, and we're providing that opportunity. So the role of the Brighton Park Neighborhood Council and the community partner is really to bring all of these people together to recognize the impact of trauma, as Arturo mentioned, and also to recognize kind of how health intersects with education, intersects with violence prevention, intersects with economic disparity and poverty, so that we're able to work together to provide a full spectrum of services that's coordinated and efficient and is the most effective possible way for clients to access those services.
A question for you both. What are some of the challenges you've encountered, and how did you and your team overcome those challenges?
I think one of the things that, as a provider, being able to advocate for the continued investment by St. Anthony Hospital to grow and expand the mental health services that we offer free in the community, because essentially this is a charitable department that we've been able to grow throughout the years. And, as it goes with health systems, really very intentionally, people have to be diligent with their resources, right? So I've been very intentional to make sure that we can advocate for why these resources and this type of investment matters. I think that more hospitals can be doing this type of investment to offer these free social services in the community. Every hospital has to maintain its nonprofit status, and through that, of course, documenting community benefits. What I've seen in my research, unfortunately, is that more hospitals often than not will write off bad debt as charity care as a way of meeting that nonprofit requirement, where I think we all as program administrators, as leadership within health industry and within the hospital systems, is we could do more to advocate how far actual investment in professional staff to offer these services within community partnerships can go to really addressing social determinants of health. Again, that waitiness I spoke about in the previous podcast means that people are actively looking for resources that do not exist. And when it comes to mental health services, For us as a collaborative, we've really been trying to redefine what that means and what alternatives we could provide, both as everyone carrying a little bit of that weight, right? Community organizations, community leaders, hospitals, health systems. We all can be doing more to be able to be meaningful in our investments.
Brighton Park and the Southwest Side, generally speaking, is a low-income community of immigrants, predominantly Latino, but it's a growing Asian population as well. And we are living the disparities in the healthcare infrastructure, the disparities between in the public infrastructure, but also in the interplay between the public and private. And that includes the gaps and disparities in Medicaid and Medicare, in the public hospital system, in the private health insurance. And if you are an undocumented immigrant, you do not have access to any kind of insurance. The investments that are going on right now that we're referring to in terms of private hospitals trying to address these systems kind of internally, right, with whatever resources they currently have. Because we're seeing this on a daily basis, it's not going to be enough. We know we need to dramatically increase the public investment in healthcare in Chicago, in Cook County. And that includes mental health care, but also primary health care. And it is going to have to happen in a way that would include public investment in actual public clinics, in reopening the closed mental health care clinics that happened in Chicago, but also in new grant opportunities and new funding opportunities for private hospital systems, for private healthcare operators, for social service providers to work together with the city of Chicago, with Cook County, to expand their free services on the ground in the community. And that's really the only way that we're going to be able to truly address this system. It's not going to happen only through charity care or through the hospital systems opening. We are extraordinarily impressed and satisfied with our partnership with St. Anthony Hospital and the incredible commitment that they have to the low-income community in Brighton Park and the Southwest Side. The commitment that they've made to fully invest and hire staff that are providing free services. It is addressing an enormous gap. But even that isn't enough. Even that's not enough. And so we need to really rethink the way that the private system is working with the public system and the amount of dollars, actual dollars, that we're going to be reinvesting in and supporting this expansion.
The Community for Collaborative Wellness comes down to a word: partnership. What do you both see as its future? Where are these kinds of hospital and community partnerships headed?
Part of the Collaborative for Community Wellness has been to be responsive to the needs of the community as a way of amplifying that voice and taking it into the policy arena. That has been a tremendous success, and already we've seen the conversation and the dialogue change at a city level when it comes to talking about mental health access. I think one of the things, for example, that we were really clear about in our findings was that people, even when we talk about mental health, want the language to also change to be responsive to what people are living, which again is the experiences of trauma on a daily basis. I think what we're looking to do moving forward is to really think about how far we've come when it comes to other health issues and trying to invest in preventative services, for example, diabetes, heart disease. I think mental health services is really that crisis that no one is naming, right? Because mental health permeates so many other issues, as Patrick mentioned and as we referred to in other podcasts. But it also means that the medical system is not allowing people access to treatments in a way that's preventative. Instead, we're responding to crises either by police intervention. Cook County Jail is by far the biggest mental health provider in the city and in the country. There's been plenty of even Cook County Sheriff Tom Dart has pointed to that as a de facto mental health hospital. And we also have people showing up to hospital emergency rooms, which are being deferred because people do not want to incur the cost of hospitalizing people who are showing up with behavioral health crises through the emergency department. So part of what we're really looking to do is redefine the issue of mental health in a way that doesn't address policy in any one solution, but really thinks about comprehensively how do we change the narrative when it comes to mental health access in this country. And again, thinking of alternatives to the managed care model, which again has a big prohibitive barrier when it comes to the copays and other costs associated with care. So, even people who have health insurance, we're seeing through national research are really limited to access to mental health services. As Patrick mentions, within the Southwest Side and throughout Chicago's low-income communities on the west side, the south side of Chicago, we see other access issues that are so severe when, unfortunately, those are the areas that are most impacted by violence. And we really want to make sure that that is a narrative that drives our policymakers to think about solutions.
Healthcare is a right. And one of the things that I think we are going to be working on in terms of next steps for the collaborative community wellness is really fully enunciating that right and making sure that all of our policymakers understand that fact, that mental health care and that health care is a right, and that we need to start developing policy that recognizes that fact. And so part of our job, right, is to really educate the community, educate leaders in the neighborhood as well, that they have a stake in this and that they are leaders in the battle to really win more resources and more equity when it comes to healthcare. And also, I think, building off of what Arturo said, what we're going to be doing, what some of the next steps are going to be, is also to recognize how addressing mental health care, how increasing and expanding access to mental health care and to primary health care can also affect so many of the other social determinants that are impacting and that are creating barriers for low-income residents to address their health needs. And so by doing this, I feel like we're going to be building a stronger and more vibrant and more responsive healthcare system for the Southwest Side and hopefully for Chicago as a whole.
We'll wrap it up on that note. Thanks, Dr. Carillo, and thank you, Patrick, for sharing your important work on behalf of advancing health in America. If you want to learn more about the Collaborative for Community Wellness, you can access the rest of this 3-podcast series. The 2 companion discussions are Breaking Down Mental Health Access and Research and Policy, How Health Disparities Data Informs Change. And if you want to learn more about the work that AHA is doing with Unitas US to advance health equity, visit us at www.aha.org/alliances. Thank you for listening. I'm Tom Petterly, and this has been Advancing Health, a podcast brought to you by the American Hospital Association.